Okay, I think it's recording a video as well now. So welcome everyone to our Breakfast and Learn in December. This session is going to be recorded. So if you don't want to appear in the video, please turn down your camera so that you're not recorded. As every month, thank you so much for joining us, for coming. And we will have a presentation with two speakers that I will introduce in a minute. And as always, you can start if you come up with some questions or some comments or whatever, you can type them in the chat box. And then after the presentations, you can also raise your hand and ask any question or comment that you want to do out loud. So why are we here? So a brief presentation that I will be sharing. We are the TECSAM Network. So we are a Catalan network that brings together research groups in Catalonia that are doing research in mental health. We are coordinated by Parc Sanitari Sant Joan de Déu and Fundació de Recerca Sant Joan de Déu, and we are funded by the Generalitat de Catalunya. Nowadays, and from our beginning, our goal is to bring all the research and innovation that is getting developed in Catalonia, focused in mental health, closer to the society, closer to public and private entities, and especially closer to people with mental health problems. And at the same time, we try to keep a close, to pay attention and to keep a close eye to all of these public and private entities, to the society, and also to people with mental health issues, to bring this information back to the researchers and to the innovators, so that their innovation gets more and more based on the real needs of the people. So nowadays, we have around 60 groups, 60 research groups from all around Catalonia in our network. So we have groups from the main universities, hospitals, and research centers. And today we're here because during our development as a network, we have been trying to establish connections with other similar networks, not only in our region, but also abroad. And we have developed a really, I would like to say, a really special connection with Northern Sweden. They were here earlier this year visiting us and getting to know a little bit of our ecosystem, and they have also helped us create connections with their ecosystem and their key agents, and we are planning to do some more of these on the years to come, and especially 2025. We have some plans in the making, and we decided that it would be a really good idea to invite them, so that all of our network would also know more about how this Northern Sweden innovation ecosystem works, and also to hear about some of their success stories. And that's why today we have here our colleague Mats Falck, and also Joakim Blomqvist, who is the founder and CEO of Insightgap. So I stop sharing my screen, and I will tell you just a brief sentence about our speakers. So Mats is the project manager for the support office for life science and health at the Umeå University Innovation Office. And he tells us, and I know for a fact that this is true, that he's passionate about innovation, business, and also regional development. And he has been passionate about that at least for 30 years. So he has, I think, a lot of experiences and knowledge to share. And regarding Joakim, he's the founder and CEO of Insightgap, as I was telling you earlier. And he's a psychologist, and he's passionate to make mental health easier to understand. So Mats and Joakim, the floor is yours. Welcome, and thank you so much for your time today.
Thank you, Iris, and thank you for having us. It's always a pleasure to work with you. I will share my screen and hope you will see.
Yeah, it works.
The screen. Yeah, and as I said, as you said, Iris, I'm Mats Falck, working for Umeå University, and I'm the project leader for support office for life science and health at Umeå University. But I thought I start a little bit with putting us in the right place and where is northern Sweden and what we do, and also what kind of focus areas do we have for European cooperation. So I'll start with that. So actually we are based in the very northern part of Sweden. We are like 2/5 of Sweden, the surface of Sweden, which is just a little bit bigger than Greece and 5 times the size of Catalonia, but only with 500,000 people, almost 500,000. I've rounded it up a little bit. But we do have the region consists of 2 county councils and 29 municipalities. And as you will see further on, the county councils are responsible for the healthcare, and the municipalities are responsible for care, social care in Sweden. The primary care units are 54 in the region, and we do have 7 expanded primary care units with beds, so you can stay overnight, as it's so far from certain villages and certain cities to the hospitals, which are 7. Then you have to stay overnight from time to time at the primary care unit. There is one university hospital in Umeå, and it's connected to the University of Umeå. That's the university, the biggest university in northern parts of Sweden, and it has a medical faculty, and that's the only one in above Uppsala that have. Uppsala is close to Stockholm, which is like 600 kilometers to the south of Umeå, and Luleå is still around 250, 270 kilometers to the north. And that's the second biggest university here, and that's Luleå University of Technology, and it's a technical university, as you can imagine. They focus on minerals and mining, energy, industrial processes, but also medtech and precision health. We do also have another university, the Swedish Agricultural University, which is also connected to life sciences, but more for plant science and forestry. And there is about 200 life science companies in the region. So that's a brief, and you can see that. I don't know if you can see my arrow, and can see that. Yeah, the Arctic Circle is going around here. That's the Arctic Circle. So then you know where we are. Some of the focus areas that we try to establish cooperation around, and what we are good at is one is of course the innovation and development side, and there are many support organizations for ideas within life science and health to accelerate business. We actually have a visit today from a documentary journalist and filmer and what do you say, film artist. He is doing a documentary about good things that happens in Europe and for the European development, and he found the life science community in Umeå. I don't know. Yeah, we were glad, so he's coming here, and he will do a documentary about the life science community in Umeå and Västerbotten, which is good. But there is also a combined innovation support system with a habit to cooperate between academy, industry, and public sector. And I think that's why we found exactly TECSAM so good. It's a kind of a sister project, because you all already has done so much in this respect, and you're really an inspiration for us as well. There is the life science and healthcare areas are also a priority at the regional level with strategies and so on. And we run the Sweden's largest AI program for humanities. It's Wallenberg AI Autonomous System and Software Program, but it's the biggest privately funded research project in Sweden ever, and it has a lot of parts. But Umeå University run the humanity side of that. And we also do have the largest biobank in the world, except for the Mormons in Utah. It has been built up through the Västerbotten intervention program for over 50 years. And the Västerbotten intervention program is actually a longitudinal study, and it's an intervention program for it gives you a health examination for everyone when you turn 40, when you turn 50, and when you turn 60. And then if you want to leave a sample of blood, it's guarded, and you can look when you turn 70 or 80, and if you fall ill, then you can go back and see, is there any indication for that illness in the blood samples that you left when you were 40, for example. But it's for public health and prevention, and it's one of the good things that you do here. And basically the intervention program is to reduce cardiovascular diseases and diabetes, but one effect has been the biobank. There is also another longitudinal study that's called Monica. It's for asthma and allergy, you say. And a third one is Salute, which is an initiative for children's health between 0 and 18 years. But lifestyle support and research around public health and prevention is really big. And then precision health is also something that has come last couple of years, and Luleå Technical University is big on that. Yeah. Another thing, as you can imagine, is the rural medicine, of course, since we were 500,000 people, and the area is bigger than Greece, or 5 times as big as Catalonia. So it's an acquired knowledge because of the demography and the geography, and we have been trained on application and operations because of this. The distance spanning technologies has been developing over a long time, and Norrbotten, the region to the north with Luleå Technical University, is really good at the technical side, the distance spanning technologies, and Umeå University and Region Västerbotten is really good at the clinical side with this distance medicine, or the rural medicine. We do also have a lot of projects that we have been running. One of them is Västerbotten Without Borders, where we had nurses and doctors in Spain, and they had patients in the northern parts of Sweden, in Västerbotten, and there could be a doctor in Spain that were responsible for a elderly care center, for example, and they did their rounds digitally, for example. That's one thing we have done. And in the mental health sector, there is research, a lot of research going on. We use a lot of distance spanning technologies for the mental health side as well, especially for young people. And since they can avoid like maybe 400 kilometers car ride for each intervention with them, or each meeting with a psychologist or treatment. It's so good that they can stay at home as for some of the meetings anyway. And there is also clinical work that is done, and the geriatric center, for example, at the University Hospital in Umeå is well known in Sweden, and they do a lot of research to improve the geriatric care. There is also contact and habilitation centers around. I thought I say a few words about the Support Office for Life Science and Health as well, which is a kind of sister project to TECSAM. TECSAM. We are trying to identify needs and develop ideas in a structure for cooperation between project partners, and all the project partners you can see in the bottom of the slide. So both universities that I've been talking about, Umeå University Holding, which is a holding company that could invest in startups, and also have the innovation office for Umeå University. Both regions, Region Västerbotten and Region Norrbotten, and also 2 municipalities, Umeå and Skellefteå, which are the biggest municipalities in Västerbotten, and Umeå is the biggest municipality in northern parts of Sweden. So we do get both the healthcare and the care. When we try to be a joint support function for counseling and project support, and also take care of the IPR that comes from the projects. And we want to identify and refine intellectual assets and ideas from research and also from clinical and care settings, and introduce them in the care setting. So that's the implementation is really important. And I think that's what TECSAM also are working with, and they are really, I think you're an inspiration for us, as I said. But the Support Office for Life Science and Health could also be a common entry point for you guys to access networks in North Sweden. And we can also help to identify and refine ideas for innovation and utilization and commercialization that is needed here. And we can help you find collaboration partners and guide you to the right resources for your projects as well. And as I said, we focus on the areas that I've mentioned, but we also are really strong in, for example, cancer research and virology. Virology. A few contacts. I'm the project manager for the project, the Support Office for Life Science and Health, but the North Sweden Life Science ecosystem is bigger. Maria and Nils and Thomas is also a part of the support office, of course. But these are the contacts, and you can also find the homepage there. And this is what you will have from Iris later on. So thank you.
Yeah, I will be sharing all the presentations with you guys, and also the names that were mentioned in Matt's last slide. We are lucky enough to have some of them also here in the audience. So hi Maria, hi Thomas, thank you for joining. And maybe they can also talk a little bit during the Q&A if they feel like it. So sorry, just to give this bit of information. You can go on.
Perfect. Yeah, just
Yeah. Hello, everyone. Is everyone seeing my screen?
Yeah, it's working. Thank
Great.
you.
Yes, my name is Joakim. I'm the founder of Insightgap. So happy to be here. So thank you to Mats and to Iris. It's going to be fun to explain a little more about Insightgap and what we do in this field. Making mental health easier to understand, that has been my passion for 15 years now. And before I go into the problem we want to solve and our solution and projects we are doing, I just want to speak a little about my own journey, why I'm feeling so passionate about making mental health easier to understand. It hasn't been the case for me all my life. Actually, when I was 18 years old, I wanted to be a professional football player. And I had my brother who was really successful. He played for Milan and Manchester United. He actually won the Champions League on Nou Camp in 1999. So I had a lot of inspiration from him to succeed as a football player. And it went quite well for me. But at the age of 18, the doctors discovered I had cancer. So I had a big tumor. I had non-Hodgkin's lymphoma. So from one day, football being the most important, I felt like football isn't that important. The most important thing is to live and to feel joy and so forth. So that actually started a different journey for me. I started to educate myself. I became a meditation yoga practitioner. I studied as a psychologist because I wanted to understand life's bigger questions. I was healthy 2 years after my diagnosis. The doctor said I was free from the cancer. But it put me on a journey in 10 years, like to understand myself and what made me feel good about myself. So that is my journey. I will talk a little more about that and Insightgap in a while, but I just wanted to state the problem. Mental illness costs both in money but also in suffering. I think everyone knows that. In Sweden, they have made some estimation like 3.5 billion euros per year. So, I mean, we all know mental illness is costing a lot of suffering and also money. What we are focusing on is the proactive solutions. We need to have reactives, healthcare, and so forth. But what we see is we need more proactive knowledge raising and preventive efforts. And we also can see in studies like going proactive is a good investment. So that is good that we can see those kind of studies now that actually show that. But the thing is, about 95% of the investments are currently invested in reactive efforts. And I think maybe this is the same in Spain. And I think it's the same all over the world. We wait until we already have big problems, and then we put efforts in. So what we've been working with for many years is trying to understand how we can work better proactively. And our journey actually started when, as I said, I did an own journey for 10 years, educating myself as a psychologist and meditation teacher and so forth. But when I started working as a psychologist at a health center here in Umeå, I was the only psychologist. I worked only 50%, but I had 60 persons waiting in line to see me. So I felt this is really heavy to have and the list was growing. But I had some good managers at the health center, and they gave me green light because I wanted to invite those people waiting to see me as a psychologist in order to raise their knowledge. So just educate them about mental health and how you can work with it on your own. So I invited all the one waiting to see me, and they had depression, anxiety, and so forth. And I I put them in the same room, and then I started to wanting to explain mental health to them. In the beginning, it was really difficult, as you may understand, but I worked a couple of years trying to understand what is the most key things we can teach about mental health. What is the key things that will make them feel more empowered and so they can start work with themselves. And we did some, I had a colleague that was, vad heter man säger, forskningsexamensarbete, Mats, what's, when you do we did a study about how I worked, we had 6 times we met the people and the patients, 1 hour each, and we tried to explain mental health. And then we made a study to see if it was effective, and it really was effective. We could see their empowerment really increased, and they felt much better about working with their mental health on their own. But I felt those 6 times that we met was still a really long time. So I wanted to make it even more effective. And then I was inspired by Hans Rosling. I don't know anyone heard about him, but he's a famous Swedish guy that made statistics really easy to understand. So he's quite famous all over the world. And what he did when he explained how the world looked statistically is he used animations and visualizations. And when you looked at his presentations, it was so easy to understand because it was a lot of animations. So I was really inspired and felt I wanted to use the animations and the visualizations in order to make mental health easier to understand. And when we started doing that, it made a real big difference. Because when I talked about the mental health, educated about it, and used this visual, it was so much easier for them to understand themselves and their mental health. But I did that for a couple of years, but then I wanted to scale. I wanted to reach more people with this visual explanation about mental health. And then I was through the university and an incubator here in Umeå that the university supports. We have spent a couple of years trying to understand how to scale our solution. So today we offer a digital project, digital education about mental health. And the last year we have been trying to certificate organizations, in their way of working proactively. So I will show a little more about this. But this journey had taken me 10 to 15 years, going from the traditional education, make it more visual, make it digital, and now we certificate organizations. So it's been a long journey, but a really interesting and fun journey also. And it's been possible because we have a good support from university and our incubator here in Umeå. And what we do is we offer a digital education. It only takes 25 minutes to do. So we offer this to organizations and also different partners. When everyone has done the digital education, they will reflect with help on AI. So they will answer question, what did they learn from the education? What is their motivation? How do they see their future working with their mental health and so forth? So we collect a lot of data with AI, and it's qualitative data. So the AI makes them right answers, and so we can really see more deeply what they think about mental health and what their motivations is. And then we collect everything in an impact report that we send back to the organizations when we didn't. And this is just some of the quantitative data that we see, but we can really see doing our digital education about mental health, they get a really big increase in their understanding on how they function inside, how mental illness occurs, how they can strengthen their resilience to mental health. And the most, I think, exciting thing is we see the motivation and confidence in their own ability to create a positive change also drastically goes up. And that's always been a thesis, that that knowledge is connected to motivation. The more we understand something, it easier it becomes to really make a change. So that is really great. Last year we won a big innovation prize in Sweden. They say it's the biggest innovation prize in Sweden behind Alfred Nobel. Like we could, I mean, the Nobel Prize was yesterday, but Skapa, as its name in Swedish, is after the Nobel Prize. They say it's the biggest one, and we competed against a lot of different innovations like environment and so forth, but they actually saw that we had the best solution for that year. So I was really happy to see that they promoted mental health and innovations in that field. We also been selected for a new incubator now in Sweden, and it's founded by Tim Berglund Foundation. It's the Avicii Foundation, if you know. He was a famous musician, and he took his life way too early. So now they have a foundation in his name working in the field of mental health. Also Reach for Change, maybe you know about that organization, but they try to create change. So Next in Mind is an initiative to scaling well-being for emerging adults in the Nordics. So they have chosen 20 initiatives in the Nordic countries. So 5 from Sweden, 5 from Denmark, 5 from Norway, and 5 from Finland. And we all have different solutions, and they want us to meet and to collaborate and to see not one solution is going to work to make everything better, because we need the cooperation. So this is a really exciting project that we can work from different countries and try to learn from each other, and also how can we. So that is really exciting, and our way into this is to work through the sports. As I said, I'm a sport background, and during 2025, we will certify the whole Swedish Volleyball Association and all the clubs, volleyball clubs in Sweden. So the first thing is they will all do our education, and then we'll start talking about mental health, and we will have them answer our questions and have them get an impact report. The next step is they're going to certify also. They are going to arrange a European Championship in volleyball. So in 2026 or 2025, we're going to certify the whole European championship in volleyball. So then we will also look at different countries and how we can expand this in volleyball throughout Europe in the beginning. So that is really exciting, and I think volleyball is maybe the biggest sport with the most active participants in the world. I don't know if it's true, but they say they have 800 million people playing volleyball. So it's a big sport. So we're doing this together with Swedish Volleyball, but also have knowledge partners, like you can see down below, Tim Berglund Foundation, and also RISE. That's the Swedish Science Institute. I think that's the correct name for it. So we have really good knowledge partners in this project, but we're also looking for partners that are going to pay for everything. So that is the next step to really find the organizations that want to be part of this, and then we'll go in with more money to make it possible. We also have a project in Umeå where we will certify all of Umeå's associational life, like all the sport associations and all the culture associations. They will get for free able to do our education and so forth. And this will also be paid by organizations in Umeå. Like we already have a done deal with some organizations that are going to make this possible. We are only going to provide the opportunity to certify everything. So that is a short presentation about Insightgap. And we would love to, we're looking into, because we can do our digital education in different language. So it would be easy for us to collaborate with partners in Spain, maybe through sports or university, and try making this certification in Spain and Sweden, and maybe seek some EU funding for that. So that is what we've been talking with Mats also about, to having that kind of collaboration, because it's easy to use our solution because it's digital and we work AI and can have different languages. So that is, I would love to hear some thoughts about that after the presentation. But now I just wanted to show you a sample from the education, if it's okay. So you can see how we're using our visual explanation in order to make mental health easier to understand. This is only pictures now I show in the keynote presentation, so it's not the actual education, but it's pictures from it, so you can see a little bit more how we educate about mental health. The first thing we teach people is what is an emotion, and it's a lot of interesting findings in science right now about our emotions. Lisa Feldman-Barrett, maybe it's the most key person there, and she's studied the brain for many years, and she's now confident that our emotions is the brain's best guess how we should feel in the moment. So she's going against the notion that emotions are hardwired into the brain, like we react to the environment with hardwired emotions. She's saying no to that, and she's seeing through her science that our emotions is unique for every situation, and our brains predict what's going to happen, and they do it through creating emotions. And when our brain creates our emotions, it uses 3 ingredients. How we feel in the body, what's happening around us, but it compares that to our previous experience. And that is really key for people to understand. And when we talk about previous experience, we talk about the heritage, the DNA, of course. We are born not as blank papers, but we come in with a personality. But we also have the environment, the family we grew up with, the society we live in, the culture, the religion, and so forth. So we all have a unique experience with us. And those experiences, when we learned what was good, when was I good in school, my parents will tell me, thumbs up, so you're really good. But we also get experience when we learn that is not good. Maybe the society tells us, the parents tells us, and so forth. And we also have those experience when we have more or less traumas in our lives, like emotional, we don't feel loved and so forth. Maybe we are being bullied in school. So we all have this unique experience with positive and negative experience. And this is what our brain uses when it tries to create emotions. And when our brain uses our past experience to create an emotion, it starts in our body. So our body gets first affected by the emotions, and then it's also alter our perception about ourselves and our life. And then it also steer our strategy in life, our actions. So when our brain compare what's happening right now with a positive experience, it will create well-being in our body. It will create positive and appreciative thoughts. I'm good. This is going to be good to have this lecture. Everything feels really fun and exciting. And I want to do more of what feels good. But if my brain would find a negative experience, maybe a negative experience the last time I was talking to people digitally, then it would create stress and discomfort in my body. I would have negative and judgmental thoughts. This is going bad. What's going to happen? No one is going to listen, and so forth. A lot of negative and judgmental thoughts. And this will lead to a desire to avoid or fight what doesn't feel good. So this is how our emotions work. We have those more positive emotions and the more negative emotions. And this is really important for people to understand about their mental health and well-being. And we also talk about emotions and feelings, because when we get aware and we look inside and see, what do I feel right now? How does my body feel, my thoughts, and so forth? We can use our awareness to put words on it. Oh, I feel happy, or I feel I have good self-confidence right now, or maybe I just feel confident. And helping people to understand the names they put on their experience is a subjective thing. We can use whatever words we want in order to describe what we are feeling right now. So that is more a feeling. The emotion is something that drives us all the time in almost every situation. Our brain tries to produce what it thinks we should feel. When we get aware of this and we put names on it, then it may be, oh, I feel scared, I feel stressed, and so forth. So we also show this when we feel this stress and discomfort. And what's important here when we teach people is like, we can say that we feel fear, or maybe that we feel anxiety or stress. It could be the same experience, but we use different words for it. So that is really a key to understand, that it's a culture thing also. Today we see in Sweden, a lot of young people talk about anxiety and depression and things, but sometimes they just feel afraid. But it looks like more serious when we talk about like anxiety and depression. But I think that is important to understand. What words we use to describe our experience isn't set in stone. We don't have those emotions that are a set of emotions that are for everyone. As I said, our brain creates these unique emotions all the time, and what we put words on it, that's a different story, our feelings. So this is something we teach in our education, and that it's really good to start to become aware and put names on our feelings and our emotions. That's the first step in order to actually work with what we're feeling. And also what we teach them a bit more about is the inner conflict. Like, I imagine everyone listening to this maybe have thought sometimes, I need to stress less and get better at saying no. Maybe at home, maybe at work, but I need to say no in order to get more time with my family and so forth. So we tell ourselves, this is important for me. But when I come in a situation where I need to say no, maybe to my boss, then my brain could find an experience that those around me are going to be disappointed when I say no. Maybe I learned this from my parents or society. And when my brain finds this, it will create a lot of stress in my body. And thoughts and perceptions like, people will think I'm letting them down, maybe I will lose my job, and all those negative thoughts are coming into my experience. And what do I do in order to control that? Of course, I say yes, because then it feels good. But the thing is, I will let myself down. And this is what we learn, people. It's one thing to have a goal, like I want to stress less and so forth. But the brain is going to use your past experience in order to help you navigate. And this is when it gets complicated and difficult to being a human. Like, we want to do one thing, but our emotions may steer us in a different direction. So just one more example about this. I want to invest 100% effort and do my best to succeed. I often use this example in sports. Like, in sports, everyone wants to be their best and do everything they can to win a game, example. But if they have been losing for a couple of games, they have been receiving negative criticism when they failed and so forth. And when the brain connects this situation with that experience, it will create a lot of discomfort and stress. And I thought that if I fail, everyone will think I'm worthless and so forth. And my solution often is I must avoid failure at all costs. So maybe I don't do my best. I just stand with the sideline and watch everything because I'm so afraid of failure. And now I just want you to reflect, because previous Nobel Prize winner, Daniel Kahneman, maybe you know of him. He wrote the book Thinking Fast and Thinking Slow. He won the Nobel Prize in economics, but he was a psychologist. And he talked about system 1 and system 2. System 1 is our emotional thinking and actions. And system 2 was more our awareness, how we can use our conscious ability to actually think different. And he said that between 0 and 100%, how much do you think our emotional system is steering our thoughts? Just maybe Iris can answer that. How much do you think the emotional system is steering what we think? How many percent?
That's a really hard question to answer. The first number that I came up with was 80%, but I thought that's too much. But
yeah, and he actually, of course, it's not, he just made an approximation. It's not that easy to say, but he said almost 98% of our thinking make up our thinking, the emotional thinking, and up to 80% of our choice and decisions. So that's why emotion is a key factor in our mental health. The more painful experience we have, a more negative experience, they will affect us a lot in life and create a lot of negative thinking, maybe about myself, about life, and it will also affect my strategy. So this is really what we feel a key for people to understand, that our brain is actually steering us from our past experience. And we need to wake up to this reality and use our awareness in order to take more decisions that are better for us. Maybe together with a psychologist, maybe with doing meditation and so forth. But this is the key, we think, in order for people to start reflecting. How can I use my awareness and consciousness in order to take more positive action in life? So this was just a sample from our education. We have more about the solution, but I just wanted to show you how we use this visual explanation in order to help people to better understand themselves. So with that, I'm thanking you for listening to this presentation, and will happily answer some questions about this or something else, and love to talk about also possible collaborations.
thank you so much, Joakim, and thank you, Mats, as well. If you can stop sharing your screen.
Thank you.
We will share the presentation afterwards with all the contacts, so everyone will be able to get in touch with you. And I don't know if anyone is ready with some questions. Otherwise, I have some written down. I don't know if Xavier wants to ask a question.
I do have.
Okay.
Thank you very much. Can you listen to me?
Yeah, perfectly.
So thank you very much, Joakim. I have a question for you, or indeed several questions. I am not sure what Insightgap is exactly. Is an NGO? Is a university spin-off? Is a private company? And I missed something on your professional journey, because I initially understood that your audience, your customers, were patients or citizens, and you wanted them to empower them with knowledge on mental health issues. But at the end, it seems that your customer are companies, are institutions, and you certify them. And I am not really sure on what exactly you certify them? Thank you very much.
Yeah. I can answer that question. The certification is, you really have a good questions, because the certification is something we done quite recently in order to reach more organizations. But our solution is, we are looking into the healthcare system. We're looking into the sport. So we're looking into many different areas, and the digital education is the key. But then we have when we try to sell it to organizations, because that's how we are making money right now, the certification is something they really much like. So the only thing why we certificate organization is they want to show something. So we are working with that, but the key thing is our digital education. And we're also talking with healthcare systems to, what we see is that doctors have a lot of time meeting patients and trying to explain, like mental health. And could they use this as a first option, and then talking with them? Then we could see it could be saving a lot of time for doctors if they could have an easy way to educate the patients. But we are just in the beginning of our journey here, and we are looking into different ways of scaling. So you have a really good question. I like your sharpness. But yeah. So
Joakim, you can add that you started as a clinician, as a practitioner, as a psychologist at the healthcare center. And
yeah.
now this is a spin-off from the university.
Yeah, exactly.
Okay, thank you very much.
Thank you. I don't know if we... Okay, Rosa Maria is asking through the chat, how can we create a positive change? This question is really broad, Rosa Maria. I don't know what it says to you, Joakim and Matt.
Yeah, in our education, that's what the part 2 is all about, to explaining, making it easy for people to understand how they create that change. So I left that out in order to not take so much time. But
yeah, maybe she's talking about how to create it like together, like with some collaboration from Spain. I guess that was more
yeah, I understand. And then Mats maybe can answer, but I just wanted to say, I didn't talk about how we make positive change, help people, but I think collaboration, Mats can certainly say things about that.
Yeah, of course. We are looking for doing cooperation and learn from each other, and we have already learned a lot from TECSAM, how TECSAM work with the introduction of innovation in the healthcare system. And because I think that's the first step of making the world better, that innovations that are positive and affecting people in a positive way, that are actually being used in the healthcare and the care settings. Because I think there is a lot of innovations, a lot of good ideas that doesn't really reach the patients and the people that needs the solutions. So I know that as Joakim said, his journey has been like 10 years and still is a journey. And I think that what we are working on, Thomas and Maria and I, with the support office for life science and health, and with our normal work with the innovation offices and innovation centers, is to try to do this a little bit better and try to find ways to implement innovation for mental health and for other things in healthcare, really. So the European Union is of course one mean of doing that. If we can find European money to create projects. It's maybe a little bit on the way. I know that Thomas is involved in a lot of procurement project to ease up the procurement process for all the public sector that it needs to do procurement for healthcare, for example, and doing it with a lot of European partners to try to find ways of doing it more effective. So that's one way. I don't know if you want to add something, Thomas.
No, I'm just following in your path. I think there is a whole palette of different things that we have to do to support different initiatives and the whole sector of life science and maybe mental health in particular. And me myself, I work a lot with the procurement side right now. How can we make our procurement to support more innovative approaches than we're usually doing? And that means to work with the different organizations, but also to work with the companies that are providing the different solutions, because we have to create a different environment, a new environment that incorporates collaboration in a better way than today, at least. Yeah.
Just wanted to add, when we started working, when I was a health center and tried to see how we could help, I met Thomas quite early and had got a lot of help. So I mean, it's a journey, and we need that kind of support. It's been crucial for us to make it happen. So I just want to say that it's really much needed.
Yeah, it takes a team to build something that's relevant and that can actually have some kind of impact. So I wanted to, we had some questions that were given to the network before this meeting. We had Enrique Arroyo, who is an innovation manager at Park Taulí, and he was asking, how does the care process work in Sweden? I assume he's talking specifically about mental health. And he also asks, which are the main pain points that you have identified? Because I think if we can talk a little bit about that, this can help our members and also people in the audience to imagine what kind of proposals or ideas would be more relevant for you, so that we can target better in order to create these connections.
I don't know. Maybe you can add, Joakim, because you've been inside the system, so to speak. But the normal system works like you go to you contact your primary care health unit, your called hälsocentral, the health central, which is the first step, and you always have to go to your primary care unit first if you're not like acute or like having a trauma, or then you can go to the emergency ward, of course, but normally you go to your primary care unit, and then you get sent to the right facility at the healthcare in the healthcare system. And of course, in our region, it might be like 300 kilometers or 400 kilometers away from where you live. So then it's those you have those expanded primary care units or more let's say equipped primary care units, and you can be there. But for the mental health, I think, Joakim, you're the best one to. I can also add that we do have a little bit of private care, but not that much. I used to live in France, and the private doctors were many more than in Sweden. But yeah, Joakim.
Yeah, I think the health center is the primary thing. For youth, we have a different through schools and different support system for youth. But when you get older, the health center is the primary focus. But that's actually because I work there, and I see even if it's working good and people can get help there, it's the queue is getting so long. So much people want help, and that's why we need to focus more on the proactive approach also, because it's a lot of things people can do by themselves. They don't need maybe that kind of help they are seeking. Because I think when you seek help through the health centers, those people needing help should get help. We should be able to help the other ones in different kind of ways, like more proactive and learning them to deal with things by themselves or with lighter support. So I think that's a big challenge for here in Sweden and Umeå, but I think it's also quite global. Like, yeah.
Thank you.
And one of the pain, what did you say? Pain issues is the budget restrictions, that you have those silos. You have budget silos all over the place. Instead of thinking about the prevention, about the preventive work and the proactive work, if there is no budget silo for that, then nobody pays for it, and you have a lot more costs down the line. Or downstream. It's and I think actually Västerbotten and also Norrbotten has been working with the prevention side really much, but I think that they can do a lot more on the mental health side for the prevention. So that's why Insightgap is something good. Yeah.
Well, this session was scheduled. Oh, Xavier, you want to ask a question?
Yes. Because let me introduce myself. I am a researcher on mental health. I'm mostly interested on treatment, on therapeutics, and particularly I am recently during the last 5-7 years, I've been focused on shared decision making. I am really interested on shared decision making. And to achieve this goal, I've been working with clinicians, visiting patients with mental health problems, and with AI engineers. And we have developed a solution, we have a prototype for helping patients with mental health problems to participate in treatment decision making. So this project has two sides. The IT side, which has a heuristic for assessing the benefit risk of interventions, and there is a module, an educational module for patients to empower them into decision making. And once I listened to Joakim, I thought, okay, there is a match here, because our educational model is simple. It's simple. It's mostly narrative. Yeah? Depression is this. The Hamilton scale is this. The benefits, the problems with depression or with the schizophrenia are this and this and this. Functionality means this. And the side effects of medications are this and this, and vomiting is this, and seizures are that. And okay, it's narrative. Patients like the information we provide them with, because it's shown in a simple way, so most patients and families can understand the words, and okay, they are satisfied, and they are mostly satisfied because they are listened, and they are very happy to get involved in decision making. But definitely our education module can be improved and can be improved. So I got really interested when I listened to Joakim, because I thought, okay, certainly we can use Joakim knowledge, Joakim background and knowledge to improve our educational module. But then he talked about institutions, and then I thought, okay, there is not such a match, because he's more institution focused, while we are more patient and family focused. However, is there a possibility that, okay, that our two interests can get together, can join, or maybe you are definitely mostly focused on institutions than on patients and families?
If I can answer that, if it's okay.
Sure.
I would be really interested, because that has been something of a, not a dream, but seeing that potential, like having that education for families and patients, but also helping them to really make decision, what kind of help will I get? Medicine, which kind of therapy? And that is also what we talk about in the education, to help them understand, why is that kind of therapy good? Why is medicine good, and so forth. So I would happily take a discussion with you, and it's easy for us to, you can just use some of our education and do what you're good at, I'm so happy to hear it could be an interest.
Yes, I thought it was very symbiotic, because, I mean, for me, the educational module is very important, but I am not expert on that. I think it's very important, but we are not expert. We are more experts on decision making, on heuristics for decision making. And I thought, okay, we can.
Perfect match.
We could work together.
I'm not good at that. It's a perfect match, because I'm not good at that.
I think that but I have to say that we have developed an heuristic. We are quite happy of the functioning of this heuristic. It helps clinicians in decision making, and we believe that it's time to transfer this technology, and we are considering the possibility of setting a university spin-off. So I don't know how can we make.
Iris can link you because I
Don't
think
worry.
Iris know you, Xavier, and
that's
Joakim.
not gonna be a problem. Just right after the call, I will link you through an email, and we can see about the next steps. So I see a lot of people already leaving. So maybe this session was meant to be until 10:30, because always when we have more than one speaker, we reserve a little bit more of time so that we have time for the Q&A. And I still have a couple more questions written down, and I don't know if someone in the audience has more questions. And there's one that's really linked to what we were talking about right now, because Victoria Bonells from the association Malalts Mentals Catalunya, which means people with mental health problems in Catalonia, she's the general director. She also asked, do you have any supported decision-making model or models? So this is something that Xavier is working with, this shared decision-making, and from the perspective of people with mental health problems, this is also a concern and something that they really want that we work on. So we were curious if there's something about that also going on in Sweden, and how is it working? Maybe not specific for mental health, but just this kind of combined way of decision making, regarding treatment or regarding, I don't know.
Yeah, there are a lot of AI decision making prize, so to speak, and the program that I was talking about, this WASP for Humanities, the Wallenberg autonomous intelligence project, the part that is run from Umeå University is actually talking about that. The one side of it, how to include the human side in this decision making, how to get more more human AI, so to speak, and not as there is one thing for the AI that you replace human and you try to be human. The AI try to be human. It's not that. It's more for the solutions, for humanities and social sciences. How can AI actually improve humanities and social science and that side? It's not just to become more effective in the normal process. It's more, how can you introduce the human side? How can you include human thoughts or human emotions in that, so you respect them more or less. It's hard to explain, but normally
you're talking from a broad perspective, and I
Yeah.
think the question was more like for the individual, that for your specific treatment as a user of the health system, that your views or your needs are specifically taking into account in when deciding what care you need to receive. Are you also?
I don't know of that as
Okay.
anything around that.
And
but it might be worth looking into if there is something going on.
Well, I think Xavier's project is in that direction. So maybe when he explains a little bit more, then you can see if it links with something else within your network. And the last question that Xavier.
No. I was just
okay.
turning the camera.
Okay, thank you. So the last question that I have, but if someone in the audience wants to do another question, then feel free, is that we had Mireia Ross from Science for Change, and she wanted to ask about how your system is working regarding migration. So what kind of alliances or what kind of ecosystem have you established for this population to effectively reach mental health support or care when needed?
I'm actually posed the question when we were visiting you before summer. We talked about this, and I actually raised the question in our region: is there any program, is there any corporations focused on this? And I haven't found any. There is there have been a like a large influx of immigrants, but it was like 5-6 years ago, or maybe 10 years ago almost now. The last wave from Syria and like in 2015 or something, and then many people came to Västerbotten as well. But after that, the influx to Västerbotten hasn't really been for immigrants in that respect. It has been for working immigrants, because we have the lowest rate of unemployment in Sweden, in Norrbotten and Västerbotten. A lot of new green industries and a lot of need for workers. And that's not really exactly the same, but then they have a lot of mental problem because it's this fly in, fly out community. So the health centers has to take care of that as well, and that's one of the things that creates the lines that Joakim was talking about, because they are often drinking a little bit too much, and they are being away from their families from months in a row. But I haven't found anything about like immigrants and refugees like that. I don't know if Maria and Thomas have something to add, but
No, I have the same opinion as you, Mats. It's I think it's really hard to find something here in Sweden that been focusing on immigrants and mental health. But I think we actually really need to do that. But I don't know anyone.
Thank you. Thank you for sharing. Well, this might be something that's relevant for many of our members. When you visited us, we talked about Migra Salud. So there are some projects and some initiatives here in our region that are targeting this community. So that's also something we could like try to expand or to see how to collaborate in the near future. So
yeah.
Oh, Maria, go ahead.
Just wanted to say that I think it in Sweden, I think it's mostly actually the third sector that deals with this, with helping immigrants and so forth, but not like the medical thing.
Okay.
But so just a comment.
And we actually plan have ideas about a conference, an international conference in sometime towards the end of next year and maybe early 2026 about the green industries and the health problems or the health issues connected to that. And this could be one thing that we could expand, could work on together. This because it's a little bit the same problem but different causes. So so that's we could keep that in mind.
Yeah, sure. I think you also mentioned that on when you visited us. Yeah. Well, this is the last chance if anyone wants to ask a final question.
I do have just one last question in order to make sure that our match is good. Just one last question, Joakim. Insightgap is a for-profit or a non-for-profit organization?
It's a for-profit right now, but we do things more in a non-profit also. So
No,
yeah.
Because our spin-off is, if ever is set up, it will also be a for-profit. So I just wanted to make sure that we had a conflict on that issue. So I think that through TECSAM we could arrange a meeting with you and explain a bit more in depth our projects and try to consider the possibility of collaborating.
Yeah.
Definitely.
Thank you.
Thank you,
very much.
Because our goal is fulfilled, isn't it? With Xavier and Joakim connecting.
Yeah, that's great news, and hopefully other ideas and other interests will arise with this Breakfast and Learn and with our ongoing collaboration. If you, Mats or Joakim, want to make a final remark or something that you feel you wanted to say and didn't have the chance, now is your time. And otherwise, I will just...
Please go ahead, Joakim, if you want to say. I just want to thank you, and it's a great setting, and I will join next English-speaking Breakfast and Learn whenever it comes. But
thank you.
it was really interesting last month as well. So yeah, so thank you for having us.
Thank you.
Thank you.
Thank you. Thank you both.
Thank
Thank
you.
you both for joining and for sharing some really interesting insights and for fostering these collaborations. See you next year. I hope you enjoyed the Breakfast and Learn and have a nice holiday season.
Goodbye.
Bye.
Bye.
Thank you, and have a nice Christmas.
You too.
Happy Christmas. Yeah. Bye.
Bye.
Bye.